The world is modernizing rapidly, and with this, diseases are also increasing, especially the chronic disease. The prevalence of chronic disease is showing an upward trend in most countries, and today we will discuss the chronic disease that's having the biggest impact on public health, that is hypertension. Hypertension is a condition in which arterial blood pressure is chronically elevated. Now, the question is why only pressure in arterial blood vessel is considered. Remember, arteries are the blood vessels that carry oxygenated blood to rest of the body. As heart pumps blood, it exerts pressure on artery wall, and this pressure is measured as blood pressure. More than 90% of cases are said to have primary or essential hypertension, whose specific underlying causes cannot be found, and rest about 10% of cases are said to have secondary hypertension, which arises as a consequence of a specific disease or abnormality, lead to either vasoconstriction or sodium retention. The most common cause of secondary hypertension is renal vascular disease. Blood pressure measurement should be as accurate as possible so that decision can be made to start antihypertensive medication. Medical equipments needed to measure blood pressure are sphygmomanometer and stethoscope. Despite of following the standardized condition in the recording of blood pressure, three sources of an error has been identified. First, observer error, including hearing acuity and interpretation of Korotkov sound. Second comes instrumental error, which includes leaking valve, inappropriately encircling the cuffs on the arm. And lastly, subject error, exercise, anxiety, discomfort, unfamiliar surrounding can all lead to transient rise of blood pressure. According to recorded blood pressure level, hypertension can be categorized in following ways. In normal condition, systolic pressure will be less than 130 mmHg, while diastolic pressure will be less than 85 mmHg. In high normal condition, systolic pressure is 130 to 139 mmHg, while diastolic pressure is 85 to 90 mmHg. In case of hypertension, systolic pressure will be more than 139 mmHg and diastolic pressure will be more than 90 mmHg. Then comes stages of hypertension. Stage 1 or mild hypertension, where systolic pressure is between 140 to 159 mmHg and diastolic pressure is in between 90 to 99 mmHg. Stage 2 or moderate hypertension. Here systolic pressure is between 160 to 179 mmHg and diastolic pressure is in between 100 to 109 mmHg. Lastly is the stage 3 or severe hypertension. Systolic pressure here is more than 180 mmHg and diastolic pressure is more than 110 mmHg. There is one special category named isolated systolic hypertension, where systolic pressure is more than 140 mmHg but diastolic pressure is less than 90 mmHg. If hypertension is not treated or controlled, its adverse effects are seen on the organs, of which first is blood vessel. In larger arteries with diameter more than 1 mm, muscle get hypertrophied and fibrous tissue is deposited, making the vessels tortuous and their wall become less compliant. While in some arteries with diameter less than 1 mm, arteriosclerosis occurs in the wall. So what exactly is arteriosclerosis? In hypertension, the pressure in the artery is constantly elevated, which causes tiny tear and damage in the lining of blood vessels. In attempt to repair this tear, substance like cholesterol and fat get accumulated in the damaged site, which now called plaque. And the process of plaque formation is called atherosclerosis, which later causes vasoconstriction. The second most important organ to get affected is heart. It is one of the major risk factors for cardiovascular mortality. High blood pressure can cause pressure load on the heart, lead to left ventricular hypertrophy, which can be detected in ECG and electrocardiogram. Other changes in heart are myocardial infarction, angina pectoris, and atrial fibrillation. Next come CNS or central nervous system. Increased pressure in central nervous system can lead to cerebral hemorrhage or infarction. So stroke is the common complication of hypertension. Along with it, hypertensive encephalopathy, vascular dementia are also common. A CT scan of brain shows hemorrhagic changes. It is usually reversible if hypertension is controlled properly. Last but not the least is the retina. Optic fundi reveals a change, especially in retina, causing retinal hemorrhage with papilloedema associated with cottonwood exudates. WHO, World Health Organization, has reviewed the risk factors for essential hypertension, and they are genetic factor. The evidence is based on twins and family studies. The blood pressure value of monozygotic twins are usually more strongly correlated than those of zygotic twins. Family studies have shown that children of two normotensive parents have 3% possibilities of developing hypertension, whereas this possibility is 45% in children of two hypertensive parents. Next come obesity. It has been observed that obesity increases the risk of high blood pressure. When people with high blood pressure lose weight, their blood pressure generally decreases. Third is high salt intake, that is 7 to 8 gram per day, increases the blood pressure. Besides sodium, there are other mineral elements such as potassium, which are determinant of blood pressure. Potassium reduces the blood pressure while sodium increases it. Next is the saturated fat. Saturated fat also raises the blood pressure as well as serum cholesterol, whereas dietary fiber reduces the risk of hypertension. High alcohol intake can also increase the risk of high blood pressure. Last but not the least is the environmental stress. The term hypertension itself implies a disorder initiated by tension or stress. It has been observed that psychological factors operate through mental process, consciously or unconsciously produces hypertension. Along with the risk factor, WHO has recommended the following approach in the prevention of hypertension. Hypertension can be prevented in two ways: primary prevention and secondary prevention. Primary prevention of hypertension can be done by giving health education, self-care, by promoting exercise and making few changes in dietary habit like reduction of salt intake, moderate fat intake, avoiding high alcohol intake. And the goal of secondary prevention is to detect and control the high pressure by early case detection and giving proper treatment. This is all about the blood pressure. Thank you for watching this video. Feedback, suggestions and questions are always welcome. If you like this video, then please subscribe to this channel. Thank you.